Hey, all you cool cats and kittens. This is Carol here. And today we're going to talk about Cuddles. Cuddles ate 2 pounds of fresh meat. Do you know whose meat it was?
If you didn't watch The Tiger King in quarantine, I don't know what you did in quarantine.
What are you doing?
But if you did watch, you'll enjoy our episode where we talk about coronavirus's impact on the insurance industry. Stay tuned. Okay, so new product is always a positive, and National Care Dental, which is backed by Nationwide. This is the hard part for me to say, and it is available almost nationwide.
Almost. It's not in 10 states, and it's the obvious 10 states. So New York,
Florida, New York,
Alaska.
blah, 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 blah.
Actually, it is in Florida. So it is not in, I'll just clear that up, Alaska, Hawaii, Maine, Massachusetts, Minnesota, Montana, New Hampshire, New York, South Dakota, Vermont, and Washington. Pretty nice. I know all those
Washington, shocking.
initials. Those are unique states.
Why do we need another dental plan?
We need another dental plan like this one because it has a $5,000 benefit.
Right, so most of them have a $1,000, $1,500, $2,500. I've seen a $3,000, but $5,000. Now we're getting serious. Somebody's actually talking about what dental costs.
Yeah.
Yeah, because seniors are freaked out when you say, "Yeah, I can give you a great plan, $30 a month, $1,500." Like that doesn't cover.
I had a root canal and I think altogether it was $2,000.
Right.
And then
Frank's was $3,000.
it just
Yeah,
scared the crap out of
that
me.
scares me.
And I was mid-40s. And level commissions.
Level
Not
commissions,
good.
we don't need to make that be the aside. That needs to be a big deal. Lifetime level commissions.
That makes Cuddles happy.
That makes Cuddles happy. That is a big deal.
That's a big deal. That's a big deal.
So we're currently contracting. Talk to us about that. Talk to us about also other incentives we can help you digitally to try to promote that to your clients through eBlast. A lot of you don't have eBlast software or capabilities, or you just don't have the labor.
Or you
Just
don't know
something
what you don't know.
The labor. We're trying to help you. Give us your client list. We'll sign the non-disclosure agreement, non-compete, and then we can push out your message to your clients coming from you. So talk to us about that.
I saw, unfortunately today, this is not good news, on my news feed, 3 more people applied for unemployment. So now we have 30 million Americans who have applied for unemployment. That stinks. However, the good solution for us in the insurance market is short-term medical. These folks are losing their benefits. That's when short-term really kicks in. The essence of what a short-term policy was designed for. Not sure why she finds that funny.
He said 3 more people signed up for unemployment insurance.
Only 3 more?
He said, I saw today 3 more people signed up. I was like, who are those 3 people?
It was
like
only 3.
Was it 3 of our
It was
friends?
Joe Exotic,
Like 3 people.
Carol Baskins, and
It
Harold.
was like 3 more people. Can't get anything
3
past
million.
me. You can't get anything past me.
She is sharper than a
okay?
tack. So the total is 30 million.
Which is funny, because yesterday I saw 26 million. So I think it's more than 3 people signed up for today.
It's probably 5. Any rate,
Short
term was designed for short-term amounts of time, like 30 days,
right.
60 days, 90 days.
Unprecedented time for you to
This is a great
offer
time.
short-term
Great time for
medical.
short-term.
Please, dear God, if you're not contracted, if you don't know how to sell it, reach out to your marketer.
We're doing
today.
a lot of webinars. It's so easy. It's so easy. Next day, effective date, online, done. It's a big.
Can you make any
it's a
money
big
selling
call.
short-term?
You can make a lot of money because it's not part of the MLR. So it's normal commissions that it's always been. So traditional commissions probably range between like 15 to 20 depending on the carrier. But yeah.
So what, like, if you sell a short-term to, what's an average, you make $100? Make $200?
Oh God, probably 200.
Okay.
Yeah. And then if you add on like some accident, huge, critical illness, my favorite, 250.
Got it.
Done. Boom. What you got?
Well, not as sexy, but this is the kind of stuff you insurance geeks love.
You cats
This
and
is
kittens.
from equity research yesterday from Credit Suisse, and they had some good stuff to say about Humana.
Holla.
Specifically about Humana's comments on the broker channel trends. So even though I don't like to get into all this stuff, if you would like this, we can hit us in the comments and we will send you the source paper. So I'll just read a little bit of it. It said, this morning Humana raised its individual MA membership outlook to reflect better sales and higher retention versus prior expectations during the 2020 open enrollment period. Okay, so the company noted that sales have slowed for the latter half of March.
Shocker.
All sales have slowed because face-to-face meetings have been restricted for brokers. Humana has also seen a decline in member terminations. And that is the helpful part because
That's the important part.
that's,
right?
yeah,
People are keeping
we
coverage
can't get a lot of new clients right now, but people aren't flooding
Yeah.
out of there to someplace else. It said Humana is helping to facilitate more brokers adopting digital channels. Humana has seen a really strong, in quotes, telephonic sales channel, which is done quite well. I can't talk. Humana notes seniors are becoming more receptive to digital channels and telephonic sales, and the company has seen a significant increase in migration from in-person to more telephonic and digital channels. So that's what
people are doing.
That's
Zoom.
what's happening, not just with Humana, but with everybody. And the carriers that are more receptive, like Humana, to say, hey, here's how to sell digital, we'll make our digital even more easier, are going to be the one that gets the client's business, that gets the broker's business. And the broker that is saying, I'm just going to wait this out. It's probably going to be over any time now. What time is it? It's probably going to be over tomorrow. The
not that
governor's
big of a
probably going to
deal.
list it next week. I don't need to learn digital. Buddy, you're going to be left in the dust. This is going to be a long time that seniors are not going to want people in their homes.
And it'll resurge in the fall. So getting brushed up now, like she's saying, is not a short-term solution. You need to be looking flu season in the fall for when that hits again, going right back to these tools that you're learning right now, which is interesting that you're going over that because Anthem's new voice signature, they've been sending out emails to all of their Anthem partners. They got rid of Voice Vault. It's my tear. I did not like it. It was hard. I didn't like it, Cuddles. So you have to listen to their webinar before they're going to send you your code to be able to go in and do voice signature. I think that in itself seems a little clunky, so I'm trying to work through that with some of our leadership folks at Anthem. But it's a great tool if you don't have the capability right now to record the conversation with the client that is compliant. So if you have no idea what I'm talking about and you're writing Anthem, you need to reach out to us because it's a fabulous tool. You dial into a number, it's very slick, records that, yes, you've read it, I understand. You do the scope, yes, done, boom. You get a code, you put it in Producer, online app, it's done. But you have to listen to the webinar to get the code. So if you need help, please reach out to me and let me know about that.
I wanted to ask you, please tell us in the comments what your experience has been with people that want you to come to their home. So I had 2 agents call me yesterday and they said, I had 80-year-old clients
Insisted.
say they want me to come to the home.
Yeah.
And one of the female agents, she's like, should I go? And I said, well, if your state allows it, your client wants it, take necessary precautions
Right.
and do it. She goes, I don't know if I'm symptomatic. I don't know if I could end up killing her. Nobody knows.
Right.
But if the client is demanding it because the client doesn't feel comfortable with doing it electronically, then just take as many precautions as you can take. We're all feeling our way. Nobody has the answers here.
Right.
So I just felt like that was really sad. They were calling and like, we don't want to make things worse for our elderly clients.
So I've talked to a lot of agents who are still running appointments, and the one has like a full hazmat suit that he wears. I picture like somebody working for NASA, right? Like completely sterile from head to toe. He said he wears a hat, a mask, a glove.
Send us your pictures, what you're going on your
Just
sales
crazy.
appointments with, if you are, because I would like to see that.
But he's writing business. And,
Well-
and he's, trying to be accommodating 6 feet apart.
Well, Scott told me that he has his agents fill it out as much as he can on the phone, put it in their mailbox, call them and say, I just put it in their mailbox. I'll go get coffee. You go sign it. I'll come put it back in your mailbox. I'll sit in the driveway, look over it, make sure it's all fine. If I need
That's a great
and
idea.
so it's just back and forth, and they're still doing business that way.
That's the mailbox.
Which is,
great idea.
it's cumbersome, it's clunky.
Scott.
I know, I never thought Scott was that smart.
Underestimated
I
you,
never-
buddy.
Yeah, never.
Dang.
Just checking to see if you're still watching.
Dang. He's
And
surprised
please
us.
comment in the below if you're watching. Don't text me. So let's talk about this fun bunch of stuff from
Can we talk
Hague.
about how this is potentially cutting off my brain supply?
Just take it off and put on cuddles. So a lot of information came out that NAHA was successful in getting deadlines pushed back
Yes.
as far as notifications that are mandatory for.
So they submitted a bunch of suggestions to the administration that would provide, and I'll read this, provide relief for individuals to maintain or obtain health insurance during this pandemic. And basically, this is what I got out of all of this. Our pandemic started March 1st, so 60 days after the national emergency or any other date determined by the DOL. Whatever that end date is where they say it's over, they're adding an extra 60 days for people to make sure that there's no lapse in coverage, no lapse in filings of like your 5500 forms. They're giving what they say is that's for right now and that could change.
Yeah, so the summary is all your ERISA, COBRA, all your deadlines have been extended. It's okay, let's chill out.
Don't worry.
We'll get through this.
Yeah.
Don't freak if you're missing deadlines.
Yeah, don't freak.
I mean,
Because
until they change it and then we have to freak because
could
we're in
get
big trouble.
eaten by cuddles. I did my stuff. What else you got? I'm feeling pretty good.
I mean, right now we're on the cusp of everything quote unquote soft opening again, and that will vary in the 50 states.
Look at my forehead.
No, I think it looks good.
My limb's tight.
But our industry has been greatly impacted, but we've been deemed essential so that most people could continue to work. But another thing, besides working with our clients, is working within our own agencies, and that's something that we all can help each other. How are you reopening your agency? How are your employees dealing with coming back to work? And
What's realistic?
and that's something you can ask us. We can show you the blueprint we've done to reopen our office because we got 100 people in that building and 30 people in this building, and to try to figure out how to make all our employees feel comfortable at work. And a lot of people are not comfortable with the concept of coming back in.
Mm-hmm.
And then a lot of employers are not comfortable with the concept of their people working remotely because the productivity is way down. Or it's just way harder to get work done. So that's something that we've called a lot of our key partners and said, what are you doing? What's working? What have you learned? What's not? And gotten a lot of good ideas from other people that we'll be happy to share with you if you're struggling with that with your agency. This is the best time to kind of network with Scott's solution.
Love the idea of the mailbox.
It's what are people doing? What are people doing that's working? And this is where ask us, we'll share it. And if you have great ideas that you'd like to share, please send them in.
Share them with us.
If you haven't watched The Tiger King on Netflix, I would highly encourage that you do.
If you do watch
It's
it,
very relevant.
just chalk it up to experience. Don't think you're going to get smarter.
If you grew up like Christian, if you grew up cosmopolitan, I don't know how cosmopolitan is in Argentina, but if you grew up like in a city and you're not really tapped into the redneck spirit of this country.
Okay, so I love the redneck
watch
spirit.
it. You need to watch it.
We are some part redneck ourselves.
I mean,
If you didn't notice,
we didn't wear shoes all summer long. We lived on a farm.
We don't own shoes, so
We didn't live on a paved road. Okay, we're pretty redneck.
So enjoy it. Enjoy it.
You need to watch it. Get out there, people.
Get out there.
Tell us what you thought about it. If you don't watch it, you're not going to get the Carol
not
Baskin
gonna
thing
get
here.
it.
The vibe that we worked very hard to put together to bring a little levity to these hard times.
Right. You just wait till
If you like it,
next week.
you got to tell us in the comments, because if you guys like it, we are willing to be John Finley.
I love
next
John
week.
Finley.
But it's up to you. You got to tell us what you want.
She'll be Travis. Until then, good selling, folks.